Hello, my name is Dunamis Orr, and this is my presentation on theory of mind and autism. There are a few goals in this presentation, one of which is to explain what theory of mind is. The other goals in this presentation are to explain the diagnostic criterion of autism spectrum disorder, to analyze whether a child has autism through behaviors and thought patterns explained in a case study, and also to state and analyze a treatment option for children with ASD. According to Barr, theory of mind is a theory that apprehends the sufficiency to construct conclusions about other people's mental states and welfare, such as their emotions, desires, and what they believe in. In other words, theory of mind refers to one's ability to understand that other people have emotions, desires, perspectives, and beliefs. Barr stated that autistic children have had their theory of mind development disrupted. Due to their theory of mind being disrupted, children with autism have great difficulty with their cognitive and social abilities because they are unable to comprehend coherently and also communicate efficiently. Autistic children do not have a clear understanding of their own emotions, desires, beliefs, and the beliefs and desires of other people. They are usually unable to understand other people's emotions and the reasons behind their emotions. According to Colbin-Wishaw, autism spectrum disorder is a neurodevelopmental disorder that refers to the impairment of a child's cognition and social abilities and interactions. The Diagnostic and Statistical Manual of Mental Disorders states that autism spectrum disorder has 5 diagnostic features. In order for a child to be diagnosed with autism, the following features must be present in an individual. According to the Diagnostic and Statistical Manual of Mental Disorders, the first criteria states that in order for a child to be diagnosed with autism, he or she must present persistent deficits in his or her communication skills. The second criteria of the diagnosis of this disorder states that in order to be diagnosed with ASD, the individual must present restricted and repetitive behaviors and specific interests, such as playing with a specific toy or having specific behavioral patterns that are repetitive. Also, in order for an individual to be diagnosed with autism, he or she must display symptoms of autism during early childhood development process. These symptoms can include poor eye contact and other communication delays starting in infancy. The fourth criteria necessary for the diagnosis of autism is specific symptoms must have a serious impact on the individual's daily living functions and activities, such as his or her education, social life, and or career. The fifth and final diagnostic feature of autism spectrum disorder is the characteristics and disturbances associated with this disorder cannot be associated or caused by intellectual disability. Now we're going to take a look at the case study of a child who may or may not be autistic. Casey is a 6-year, 8-month old male child that has begun developing more advanced verbal language within the last year. However, before this time, Casey would scream, cry, and make noises in order to get what he wanted or needed. He had minimal gestures and would often display echolalia and little to no pretend play. Casey likes cars and trucks. He often plays with the wheels of his cars and trucks repeatedly and also likes to line them up in a line. Casey also often paces back and forth repeatedly. His mom states that he had communication delays as a baby and also poor eye contact. However, he now looks at his mom's eyes when she is talking to him, but his eyes wander off during their conversations. According to the breakdown of Casey's behaviors, it is highly likely that he has autism. Casey's case study reported that he has limited social interaction as well as a history of displaying minimal gestures. Casey also had deficient communication skills. For example, instead of verbally saying what he wants or needs, he would scream and make noises in order to get what he wants. Casey's mom also reports that Casey has a history of communication delays, such as poor eye contact. Casey also likes to restrictively play with certain toys, like his cars and trucks. He displays echolalia, which is a verbal display of uncontrollable repetition of words spoken by someone else. So Casey could often repeat or imitate his mom's or teacher's verbal expressions. Symptoms such as poor eye contact, uncontrollable behavioral patterns like repeatedly pacing back and forth, and screaming and crying instead of using his words to effectively communicate his needs and what he wants to his moms and teachers have affected Casey's ability to function properly in social settings and other important areas because his behaviors can be disruptive, especially at home and in school. Casey's mom did not report that he has been diagnosed with intellectual developmental disability, also known as intellectual disability, which means his symptoms cannot be attributed to intellectual disability. Children who have been diagnosed with autism may be unable to understand the feelings and emotions of other people and why other people have emotions. For example, Casey could hit his mom because he is angry instead of verbally communicating to her that he is angry. His mom may then show feelings of sadness or frustration, but according to the theory of mind, Casey does not have the ability to understand his mother's state of sadness or frustration because he has not been able to fully comprehend how his action made his mother sad or frustrated. There are several treatment options for children with autism within pharmacotherapy and or techniques in CBT. A treatment option that can specifically be used for a child like Casey is Lego therapy. Lego therapy can be an intervention used to target Casey's communication skills. A study completed by Owens et al. In 2008 showed that construction using Lego pieces helped children with autism improve their social skills. The results of this study also showed that the logotherapy procedure helped reduce maladaptive behaviors in the participants. Logotherapy was also helpful in the improvement of autistic children's social skills and their competence. This technique is usually helped to treat patients between the ages of 6 and 11 years old. So it would be helpful in treating Casey since he is 6 years old and also meets the criteria of a diagnosis of autism. Thank you for your time today. Here are the references for the information used in this presentation.